Hey Steve, my wife had the surgery about 6 months ago. She's lost about 50 pounds since then. My motivation is a little bit different. I'd like to lose about 75 pounds, but also I have Type I diabetes and a severe family history of heart disease. So this seemed like a really good option for me. Really, I had no pain. I tried the pump at first in the room just because I thought it would make me feel happy, and I didn't even notice anything. So I had no pain.
Do you think we should tell him we didn't put anything?
Yeah, I was wondering about that.
We gave the young girl the narcotics.
I had pretty much no nausea. I think I took 1 or 2 of the nausea pills. I got a little queasy once, and I got scared, and 5 minutes later the queasiness was gone. So really, I didn't have much nausea. I was really wiped out the first few days. My blood sugars are still really pretty high and stuff. I'm taking more insulin now still than before the surgery.
Right, and what we think is that still your body's going through that stress response. And
right.
On the other hand, have you weighed yet?
Yeah, I've lost less than a pound.
Okay,
yeah.
So your diabetes brought you to us a little different than everybody else.
Right.
Now you've lost less than a pound. In the past week, how much do you think you've eaten?
Very little.
Right.
Right.
So this is a common situation. I just got a call like this the other day. A woman named Mary who had surgery with me and was on 17 medicines pre-op.
Mm-hmm.
Okay, and post-op, she's now a week or 2 out, and she hasn't lost much weight. Well, I said, she was on a diuretic, she was on 4 diabetic
right.
medicines, and this and that. And so in patients who are a little sicker when they come, who kind of bring more baggage,
right.
their bodies can take a while to adapt.
Right. Well, I lost probably about 5 pounds before the couple days before the surgery, just from eating light, because I was huge calorie consumptions before the surgery. So.
But if you look a little bit longer, let's say this past week you've eaten 1/10 of what you usually eat.
Probably less.
Yeah, so less than 1/10.
Yeah.
Now play that out for a couple of months.
Right.
In the end, it's going to get you. A lot of our patients were really flattered and excited and happy that they lose weight within days of the surgery.
Mm-hmm.
But our diabetics, our older patients, people who are sicker, they may take a little more time.
Right. Okay.
Yeah.
The other thing I noticed that I was going to ask you about is my vision.
Yes.
Today's a lot better, but the last couple days prior to today, the sunlight hurt. Distance stuff in the distance, like street signs and stuff, was a lot blurrier, and my eyes were watering. They were getting sore. It feels a lot better today. It's not perfect yet.
Again, the response to the trauma of the surgery can cause all kinds of changes. In theory, our average patient who's in very good health, they will lose lots of salt water right away. Their other medical problems will get better within days. And so you've got extra fluid that's being kept on board by that kind of Type I diabetes. And we expect if we ask you again in a week that that's all going to go away.
Right.
And start getting better.
Okay. Do you have any other questions since my case is special?
Yeah, so what we'd like to do, again, let's just talk for a second about Type I diabetes. We'd really like to stay in touch with you because your Type I is a little iffy. It's kind of a borderline Type I, as you told us, because you had your body's pancreas making insulin for the first 23 years.
Right.
And then the insulin kind of drifted away and is gone now.
Mm-hmm.
So we talked the other day about the recent research that says the gastric bypass actually stimulates the beta cells that make insulin in the pancreas. So we'd love to stay in touch with you, maybe a little bit more than usual, and see how that sugar goes, and potentially in 6 months or a year, see if your insulin levels are back.
Right.
On the slim possibility, we might actually reverse your Type I diabetes.
Right.
Which would be pretty exciting.
Yeah, it would, but not
Not
holding my breath for that.
No,
but,
that's right. But since the research does show that the insulin-like hormones go up and the beta cells are stimulated by the gastric bypass, we think theoretically that could potentially help a little bit.
Right. Mm-hmm.
Should we take your statements
Yeah.
out? Okay.
I had my things. Oh, here it is.
You got too many pockets.
Yeah, I know. I have too many Pepto and Pepsi and bottle of Gatorade.
What is the guy with their whistling for the Clint Eastwood movie?
Yeah.
Tom.
Yeah. Really, and surprising, I don't heal that well because of diabetes, but so far I think this all went they all turned out pretty good. So
Yeah.
my wife was really worried about my port ceiling.
Yep, absolutely. Well, diabetes, and especially type 1 diabetes, affects healing. And one of the nice things about our surgery is that it's so minimally invasive. It lets you heal a little bit easier. How's your cold, speaking of?
Better. It's almost gone. I was really wiped out till Sunday, and then both the cold and the effects of the surgery at the same time started to seem to get a
You
lot
had a
better.
cold while you had surgery?
I came here at the tail end and thought I was pretty much over it. Plus, they give you a ton of antibiotics, so I was like, okay, I'm going to be good. And then the day after the surgery, it just came back, which probably because of the stress, I'm sure. Is that all?
1, 2, 3, 4, 5.
Okay, good. All right. Thank you
Question
very
the
much.
doctor.
Yeah. Just making sure. Any questions?
My friend, who I heard about this from, she was a type 1 diabetic, and she was taking like 70 or whatever.
That's what I'm at about that much right now. Is about
Wait,
Yeah,
70.
she's
rest-
down to
yeah.
like 25, and
Right.
she's like 10 months, and she's just lost 100 pounds.
Cool.
Right, that's
That would be
kinda-
nice.
That's what we're hoping for you.
Yep. All right. Well, thank you very much, sir.
See your wife.
I will. I will. Oh, I must hear what you said about the intimate relations thing.
All right.
Trying to get away.